Good afternoon, everyone. Let me just thank you so much for joining us today. As usual, I have Dr. Toomey with me, along with our First Lady, Marty Kemp. We have Georgia Emergency Management and Homeland Security Director Chris Stallings here. We also have Dr. Peacock, who's the Medical Director for the Department of Public Health, here with Dr. Toomey. And I know we have several members of the General Assembly that are surrounding us here, and I just want to continue to thank them for their support and their help with the public health state of emergency that has empowered Dr. Toomey and I in a very reasonable and smart way to be able to do things very quickly to address this global pandemic. And Dr. Toomey and Director Stallings are going to give you updates here in a few minutes, but I wanted to just give you an update on several different things. I'll start with our COVID-19 numbers. Our 7-day average of cases continues to decline at 2,172, which is a 70% decrease since last month, and the lowest number that we have seen since the middle of November. Our hospitalizations, thankfully, also continue to decline, with 2,593 COVID patients currently hospitalized. That is down 55% since last month and accounts for roughly a 16% of all people hospitalized in the state today with COVID. Another welcome sign is our 2-week test positivity rate has now dipped below 10% for the first time since November the 28th of last year. However, given the reporting of COVID deaths significantly lags behind cases and hospitalizations, we continue to see high death totals reported in our numbers each day here in the state. That is the exact reason that Dr. Toomey and I have been so focused on vaccinating our seniors. 85% of Georgia's deaths due to COVID-19 have been among those over the age of 60. As I've said many times before, this is a sobering statistic, and it should serve as a reminder to us that this virus is still deadly and it still must be taken very seriously. And as Dr. Toomey and I have covered at every one of these press conferences, we continue to ask Georgians to wear their mask, watch their distance, and follow the public health guidance that has been out there for months and months now. These trends are certainly good news, but they are a steady declines from very high caseloads and hospitalizations our state has experienced last month. We must remain vigilant, and we cannot let our guard down. Moving to the vaccine front, we continue to see encouraging trends as well. First, today, the Department of Public Health's vaccine dashboard shows that the state has administered over 1,606,000 doses of this vaccine. That is 82% of the total vaccine shipped to Georgia and includes 718,026 seniors who have received at least one dose. And another great milestone today, the Operation Warp Speed partnership through CVS and Walgreens has administered 101,000 doses in our long-term care facilities across the state. I want to make one quick but very important point. As Dr. Toomey and I have covered before, the CDC and other national websites show a constant lag in doses reported as administered and in the percent of total vaccine shipped that has been administered. Those websites are reporting the total shipped into the state. That includes both the state's direct allocation as well as the federal programs in Georgia through private pharmacies, federally qualified health centers, and long-term care facilities. The state does not control how or when those doses are administered. The state DPH dashboard will only show what the state can directly control in terms of distribution and administration. As of today, providers and public health districts continue to see higher demand than we have in supply. We are also seeing steady increases in our weekly allotment of doses. Next week, we are expected to see 198,000 first doses sent to the state for distribution and administration. I'll let Dr. Toomey give you a brief update on how the weather has impacted our current shipments and how that is now moving forward. But given this significant progress made over the last few weeks in vaccinating our current 1A plus population and the gradually increasing supply we are receiving from the federal government, the state and the Department of Public Health will be finalizing our plans for expanded vaccination criteria within the next 2 weeks. To that end, the Department of Education has sent out a survey to every school district across the state, asking school personnel to respond to basic questions about the number of employees who would want to be vaccinated if they would be made eligible. That survey, that included over 171,000 staff member responses, shows that only 45% of staff in our schools would choose to be vaccinated, or roughly 78,000 school staff in total. This survey also asked school districts to notify the state if they have already identified a local public health office or private provider to partner with for vaccines for their staff when the time comes. Many superintendents have been actively working on this issue, and I greatly appreciate their leadership in identifying ways to partner with other local communities and entities to vaccine their staff. We will now be working through that process along with DOE, Department of Public Health, and local education leaders to ensure they have all identified a partner and are ready to get shots in arms as quickly as we can once we are able to make that call. When looking at the broader vaccine distribution effort, we have some exciting news to share today. Starting Monday, February 22nd, 4 state-operated mass vaccination sites will be operational across our state. To spearhead our efforts to ensure access to the vaccine among minority communities, all 4 sites will be strategically located to ensure close proximity to those underserved populations. These sites will be located in Albany, Macon, Habersham County, and also at the Delta Flight Museum at Hartsfield-Jackson International Airport. As Director Stallings will cover in a few moments, that list of sites can and will expand as we receive more doses and expand the available supply. Our goal is for these sites to have the capacity to administer 22,000 vaccines per week between all 4. Again, with the ability to increase that capacity once the supply expands. These 4 sites will serve as a first step in a vaccination effort that we hope will dramatically ramp up over the next few months. This setup would allow us to work out the issues that arise and be prepared to scale up at a moment's notice as more vaccines are on the way. On a project of this size, you can imagine that we have a lot of local partners and others to thank. First, I want to thank the local communities in Habersham County, Macon-Bibb, Albany-Doherty for their cooperation and assistance. I also want to thank Chairman Rob Pitts, who's here with us today from Fulton County, and Peter Carter and David Werner from Delta, as well as Mayor Lester Miller from Macon and Habersham County Manager Phil Sutton. I also spoke earlier today with someone who couldn't be here, Chairman Chris Cahias from Doherty County, and I know he is very excited about the site down there. I want to thank all of you for your support, for your friendship, and for your help, especially in this effort. And as Director Stallings will no doubt mention, we greatly appreciate FEMA Region 4 Administrator Gracia Check and her team and the support we are receiving from the federal government on these projects. And I've had the opportunity to speak with her just a few minutes ago. And finally, the state leadership team who has made this happen. And there has been a lot of hard-working state folks working on this issue. Many of them you probably will never see. They're behind-the-scenes folks that are working hard every day, either at the State Operations Center here at the Capitol or at the Georgia Department of Public Health. And we thank all of them, as well as those that are on the front lines out there fighting this battle every day. But certainly Dr. Toomey, Director Stallings, General Carden, General John King, our Insurance and Fire Safety Commissioner, and all of their staffs have worked closely to bring these sites to the finish line. I'm very excited about this opportunity. I think it's going to be a way that we can continue to move the needle in conjunction with a lot of great things that are going on in our state that I've been able to visit over the last several weeks and certainly in the last few days with Chairman Pitts. And with that, I'll turn it over to Director Stallings, who I know will have some great news to share with you. Chris.
Again, thank you, Governor Kemp, First Lady, Ms. Marty Kemp, for having us here today. Very proud of what GEMA-HS has been able to accomplish. We've been working around the clock with our federal, state, and local and private partners to get these 4 mass vaccination sites prepared. This has been a monumental effort on the part of our staff and our partners in a relatively short period of time. We've been able to put together what we think is an efficient system for administering vaccinations on a large scale. Again, to echo the governor's statements, I can't thank Ms. Gracia Check, our Region 4 Administrator, for her assistance with this and some of the planning. We're all in the fight against COVID-19 together, and we knew as an agency that we could do more to support the state's vaccination efforts by expanding capacity. We leveraged the logistical knowledge that we have in responding to disasters to develop a blueprint for the 4 sites we have and ensured that they are self-sustaining with regards to vaccine storage, technology requirements, and security and staffing. The locations selected for these sites allow us to target some of the communities that have been hit the hardest by COVID-19. As the governor mentioned, Dougherty County, Habersham County. We've partnered with ShareCare, a great Georgia company, to manage the registration piece for the mass vaccination sites. From day one, we knew that the sites would only work as well as the process for getting patients registered. We've worked with the ShareCare team to make sure that the process was simple, easy, and accessible. The website, myvaccinegeorgia.com, is now live. The site is ready for you to log in and pre-register if you meet the requirements for the vaccination as part of Phase 1A+. As you can see here on our left, we've got that's the home screen, so if you go to our website, that's what you're going to see. The Yes, I'm Eligible, if you fall into any of those 4 categories, we'll get you registered. The website is easy to navigate, and we're making sure that each vaccination site has adequate technology to process patients quickly. The goal at the end of the day is to get shots in arms. The process for obtaining an appointment is simple. When you go to myvaccinegeorgia.com, you can pre-register and you will receive an email within 24 to 48 hours with additional information on scheduling your appointment. By pre-registering, you're essentially holding your place in line to receive a vaccine. Once your appointment has been made, you will receive a QR code. It will be printed or downloaded on your mobile device. When you arrive at the vaccination site, a greeter will scan your code and verify your identity before moving you forward. The provider then can go through the screening questions before administering your COVID vaccine. Once the vaccine is given to patients, we will go to a designated parking area to be monitored by health staff and wait for 15 minutes to ensure there are no reactions or issues. During that time, patients can then log on and register for their second dose to follow the same process and obtain their second vaccine appointment. Being able to administer up to 22,000 vaccines per week at these sites, we can make a significant dent in the list of people in Phase 1A+, still awaiting the vaccine. Moving forward, we will evaluate how these sites are working and how they can be further expanding into more locations throughout Georgia. None of this would be possible without the support of our governor, Governor Brian Kemp, and his staff. And I'd like to thank you, Governor Kemp, for your faith in our agency. and for once again allowing us to serve the people of the state of Georgia. I want to say one thing before I do step away, before we move into Dr. Toomey. It's imperative that you do make an appointment. The sites are appointment only, so we don't do walk-up. So make sure you do an appointment, and then we'll be able to assist you from there. Dr. Toomey?
Thank you so much for being here today and to have this opportunity to update you on many of the very good things that have been happening in the vaccination program here in Georgia. One of the questions I know you all have is, how is the vaccine supply? And we have been seeing a steady, small increase in supply over the last several weeks. And more importantly, that supply can be projected out for at least 3 weeks. And so that is a difference than before. We couldn't actually plan vaccination sites because the number of vaccines that we were told we would receive may change overnight or change by the time we receive them. You wouldn't know until you open the box exactly how many vaccines you'd received. Well, that has improved considerably. And so we're seeing a steady, slow increase and can anticipate, we hope by the 1st of April or sooner, a large number of increased doses. The bad news this week is the storms. As I've said many times before, the logistics for the vaccine distribution is not a public health problem. It's a challenge that the federal government has taken on. The vaccine is shipped directly from Pfizer, so from Michigan, where there's a considerable snow, as well as from Moderna, which must pass through Nashville, the McKesson distributor. Nashville has been really locked in for the last several days, so the vaccine that we anticipated this week is delayed, and we anticipate it will come at the end of the week or at the latest early next week, so we will have extra doses next week. But we have been getting approximately 268,271 first and second doses, so it's more than we had before, and that is something we can project out in a steady state. The other thing that's happened is that both Walmart and Kroger are getting direct shipments from the federal government. So 184 Walmart and Kroger pharmacies are receiving direct federal allocations, which is also adding additional vaccination capacity in the state. And a new program is starting next week on Monday. Federally qualified health centers will also be directly receiving vaccinations directly from the federal government. These FQHCs initially will be St. Joe's Mercy Care here in Atlanta, a longtime partner of ours in public health on many issues, and East Georgia Health Services. And we will be seeing an expansion of these federally qualified health centers in the weeks ahead. So that's really good news. That is expanding access throughout the state through multiple venues, including our public health agencies. As far as our vaccine status report, there's a lot of increases and I think improvements in both our COVID dashboard. Many of you had talked to me about, why don't you add PCR and antigen tests? That's the true positive rate. Well, that is being done now. And so I think the dashboard, as it is currently configured, it does give a better picture, both at the overall state and county level, of the positivity rates. But also our vaccine website is also, I think, much improved over when it first went up. And you can see there not only vaccines distributed and also vaccines in arms by county, but also race, ethnicity. And this is something we had talked about in prior meetings. I think recognizing that you need to have equity in vaccination access, and you also need to ensure that you account for any vaccine hesitancy. The disparities that you see in race and ethnicity vaccinations represent a combination of those factors. And we are doing everything we can to ensure that we are working diligently with community leadership to identify sites, to work with churches, work with community organizations, work with other community groups, as well, in addition to these large vaccine sites that may be more user-friendly for individuals who may have some hesitation about vaccine. But because of our concerns about, and we knew from our surveys prior to beginning the vaccination program, that about 30% of African American and Hispanic individuals who were surveyed, only fewer than 30% really wanted to get a vaccine. Knowing that, we really wanted to ensure that we are communicating as effectively as we can to all those communities throughout the state. We are standing up, in the process of standing up a COVID Health Equity Council that represents community leadership from all over the state, and we'll be working with them to help fine-tune our messaging and have them be our ambassadors in the community to help us better frame the vaccination efforts, and also work with local public health to better identify sites that may be more acceptable, maybe more welcoming to them, as well as give them the information they need to reassure them about the safety and efficacy of the vaccine for them and their loved ones. But the other thing that I wanted to say is I was personally quite concerned about the fact that that many seniors throughout the state, whether it were people in Gainesville and in North Georgia, Latina women, or people in Albany, seniors, were unable to make appointments simply because they couldn't navigate the internet. They couldn't understand how to make an appointment. They may not have access to internet or understand how to use a website to get that information. And recognizing that this was really a shortcoming on our part, we developed a program that was really spearheaded by Fulton County, and I want to call out Chairman Pitts because you were the first in the state to do this, to work in partnership with your senior centers, the area agency, the agencies on aging, as well as the Division of Aging and Department of Human Services, to have a plan to reach out systematically to seniors and to, regardless of their race or ethnicity, regardless of their ability to speak English or not, to identify who are homebound, who may be receiving home meals, who can't leave their home, and to provide the transportation, to provide access as well as the ability to make those appointments, and to ensure that they get that appointment and transport to their second dose. And we should have, in the next week or so, a plan to reach homebound elderly who can't be transported to sites. So these are the kinds of things we've been working on to ensure that equity in vaccine access is being addressed. And so these are just a few of the things that we have been working on. I feel very proud of the fact that not only were we standing up large sites, but really working on diligently to reach those smaller communities that may have some resistance to coming to these large sites, and ensuring that we reach out to them, give them the information they need, and increase access to everyone throughout the state. And thank you very much.
Well, thank you, Dr. Toomey. Before we go into questions, just let me make sure that Georgians know that we are going to run these mass vaccination sites, this appointment site, just like we do any incident command over at the State Operations Center at GEMA. Director Stallings will have his team, we'll have state law enforcement in there, the National Guard is going to be involved with logistics on these sites. We will have the full power of state government to support these 4 sites that we're announcing today, but also we'll continue to be preparing for further ramping up these sites for vaccine administration when the supply becomes available, and doing other sites around the state. And with that, we'll be glad to take any questions, and I'm sure any of these folks that are here would be glad to answer something if I cannot. Well, I think, first of all, when it comes to teachers and education, it is clear to me from following the data and the science that our kids need to be in the classroom. I've held that position for a long time. We're not going to waver on that issue, but I've left that up to the local control. I think it shows in the survey that, there's not as much demand there as some may have thought. But it does help us with the planning, especially for the districts that have actually taken the time to reply to the survey, have either already talked to a medical provider or a private sector partner that's going to help them do the vaccines in those schools, or whether they're going to do it themselves. That is why we did the survey, so Dr. Toomey and her team at Public Health can actually work with our school systems to develop a plan. If they don't have a provider, the local health department or the regional health department can help with that. But it certainly will factor into our decision, but it also shows that the demand there is not as much as some may have thought, which is good for us to have that data, because it does allow us to plan when we expand to know what we're dealing with in that category. To me, it will be a great planning tool, and we'll certainly have more information coming in the days ahead. I'm hopeful that we'll learn from the Biden administration about our long-term supply here just, any week now.
Real quick, folks, if you want to ask questions, please use the mic so our live stream folks can pick you up.
Good afternoon, Adam Murphy, CBS 46. Governor Kemp, with the opening of these mass vaccination sites, what is the state's plan to assure that we don't have vaccination vials wasted when people reschedule or don't show up and these vials have been opened?
Yeah, and I may let Director Stallings talk to this. He's been, or Dr. Toomey, either one. Our whole team has been working on all these type issues. I will say, I think in our state, our public health departments, Chairman Pitts and the medical director and I talked about this at their mass vaccination site the other day. They have, wait lists, so if that happens, they are able to make sure this is a precious thing that we have in these vaccines. We do not want them to be wasted, and I don't believe that they are around the state. But Chris, do you want to speak to that?
Two things we made sure of is that all shots go in arms, no shots go in the garbage can. So the first thing we did was we were able to secure ultra-cold storage, specifically because we're using the Pfizer vaccine only. So we'll pull only that day's allocation. We're also working with our local public health, so should someone not show up, we're creating a waiting list for those that we can get to that are close by. We can make a phone call, get them over there as soon as possible. But ultimately, the goal is to have as many folks show up. These sites are not specific. So, for instance, the Macon site is not specific to just those in Bibb County. It's anyone who's willing to drive to Bibb County to get a vaccine. Any of the sites are available. You don't have to be within that county. These are statewide mass sites, so you apply, or not apply, I'm not getting a loan. If you go on the site and you get an appointment, you come on and you get your vaccine. We want as many folks that are willing to come get the vaccine to come take it.
Yes, thank you. Could I get have Dr. Toomey, may I ask a question?
I'll also say that we are very conscious of the fact that many people want to be vaccinated or are still waiting. We have advised all sites to have a waiting list and have an on-call list, and to when they see that there's going to be some extra vaccine, to call those folks in. And I don't know of any time that vaccine has been wasted. I mean, we've been able to get people in very quickly, and they're literally waiting by their phone for that call.
Yes, Dr. Toomey, everybody welcomes the information that we'll be getting more doses every week. In the meantime, for those people who are telling us they're at their 6-week limit for getting the second dose, they're concerned about going past 6 weeks without being able to find an appointment for that second dose. What do you say to them? And then my second part of that question is, are providers okay to withhold doses in anticipation of wanting them for the second dose for their patients?
We are still advising providers to order the second dose after the first doses, but you can use, if you are running short or people come in for their second dose, you can use first doses for second doses. It's the same vaccine. But what we've said repeatedly, and CDC has said, although these vaccines were designed and studied at 3 and 4 weeks, Pfizer and Moderna respectively, and that they can be used safely at a longer window